I want to ask you to do something with me, and this might get a little bit uncomfortable. I want you to go back into your past and remember your most painful injury. Take a second and remember what that felt like. Go back and bring that memory up. Now imagine that that pain that you were experiencing, that it didn't go away. Not for hours or not for weeks, but months, maybe for years. This is unfortunately what it's like to live with chronic pain. And you probably know someone who's struggling with this today. I've been working on innovative medical devices for over 20 years. And we're going to talk about how we're transforming the future of chronic pain care. But this is really about more than electronics. For me, this is personal. You see, one of those people that's struggling with chronic pain, it's my dad. He was a firefighter in the Air Force for over 20 years. And this is a job that just beats your body up. He has pain in his back, and he's got pain in his knees. And he's living his life. But it affects every relationship that he has. It affects every conversation that we have. Pain is a constant topic for us. And unfortunately, he's not alone. There's over 30% of people worldwide living with chronic pain. Think about that for a second. Almost 1 in 3 people are dealing with this today. That means that here in the UK, there's over 10.5 million people that are struggling with this right now. So this is the giant problem that we're tackling. But there's reasons for hope. And I want to introduce you to someone. This is Erica. She's an 84-year-old living in Germany. But unfortunately, back in about 2017, Erica started experiencing pain. And she did what most of us would. She went to see her doctor. And they gave her pain medication. But as she took higher and higher doses of her pain meds, unfortunately, Erica's life went further and further down. She wasn't thriving. But Erica's a fighter, and she persevered. And she made her way to a pain specialist. And they recommended a spinal cord stimulator for her. And it worked. It gave Erica her life back. And to say Erica got her life back is kind of a little underselling it. This amazing woman is coming out of the pandemic and out of chronic pain as a fitness influencer with over 2 million followers. She's doing things in the gym here that, let's be honest, I wish I could do, but this wouldn't hold up. And so if we've got wild success stories like Erica, why do I have such a big job in front of me? Well, it's because chronic pain is incredibly complicated. It affects much more than the pain itself. It affects your mood. The medications they give you, they affect how you think. Live with it long enough, and it can actually lead to depression. And if you're like Erica, and you go to see your physician, they're going to want to understand what's going on. And they may ask you about your pain. They may ask you to rate it from maybe a frowny face to a smiley face, or even something like this that goes from 0 to 10, where 10 is the worst pain that you can imagine. But pain is incredibly subjective. Think about this for a second. The scale we use in the clinic literally asks you to imagine. So I'm going to challenge you for a minute. Go back to that painful memory. Go back to your injury and put a number on it. Can you even do that? Would you be an 8? Would you be a 9? Would my 10 be the same as your 5? How would we even compare? Now imagine the task of that clinician sitting in front of someone suffering, trying to understand them with tools like this. It's an impossible task. I think back to my dad's decades-long journey trying to find care. And he has good coverage. He has access to experts. But his incredibly circuitous path is unfortunately the norm for people living with chronic pain. He's had tests, he's had injections, he's even had surgeries for his pain. But chronic pain is insidious. The very surgeries that were helping him with this pain years ago, those are the things causing it today. This is the challenge that we're dealing with. And there are options. There are options that are working for people today. So let's go back for a second. What was that option that Erica had? What was this stimulator that was helping her? Well, when you have pain, it's actually your nerves sending a signal. Say if you had pain in your knee or in your back, it would be sending a signal up through your spinal cord to your brain, where you perceive it as pain. And a stimulator is a small electronic device, and it outputs gentle electrical impulses. And these interact with those pain signals. They block them or interfere with them. And this prevents you from being able to perceive pain in the same way. And so this is really about more than it just being a device. This small, capable electronics actually give people control back over their life. They can start to take control over that pain. And everyone perceives this a little bit differently. And so I want to listen to a couple of people that have had a chance to try this so that you can hear how they experience both pain and the therapy. And they're going to be talking about just one of our therapies called FAST.
How would you rate your pain right now on a scale of 1 to 10?
Right now it's about a 9.
About a 9 right now? Okay.
My pain level was keeping me from walking down the road. I couldn't walk a half mile. I was having problems getting in and out of cars.
I was limited to a lot of things. I did work, but I was in constant pain.
How do you feel with the new FAST program?
Pain-free.
Pain-free. Wonderful.
Yes.
Walking better.
Walking a lot better. I can walk upright. I'm not
Perfect.
hunched over.
Beautiful.
It's feeling better and better.
Mm-hmm.
I don't know what you're doing, but it's a lot better.
My experience with this program, everything else has helped me walk, move. I'm able to exercise. I've even rode a bike. I haven't rode a bike in 15 years. I can't complain about this. I love it.
So clearly I've seen these a bunch of times, but I still can't help but smile and laugh at those success stories. So it's pretty rare in medicine to be able to have a therapy that can be so transformative so quickly. Think about it. Those patients have been struggling for months, maybe years, and they can get relief in just a couple of minutes. And these are just a few stories, but our studies show that 8 out of 10 people who are offered this therapy can get profound pain relief. But think about it for a minute. We asked them, what was your score? Did anyone respond that way? No. No one cares about their pain score. What everyone wants is their life back. They want to go back to doing activities, maybe as simple as standing up or for going for a bike ride. So we thought, what if? What if we could account for all of these factors that are so important to people living with chronic pain and use them to personalize the therapy for people that are struggling? So this is the problem that we've been tackling for the last 8 years. And we've been running clinical studies to be able to give patients smartphone applications on their own phone and use commercial wearables like smartwatches to really understand this experience of living with chronic pain and what happens day to day outside of the clinic. And we can do that. We can now capture all of that data. And we followed hundreds of patients for multiple years. And we now have an enormous amount of data. And we knew that this was way too much to dump on an already overburdened doctor in an already overburdened healthcare system. That just would never work. And so this is why early in our journey, we actually collaborated with IBM Research. And they're helping us to bring novel AI techniques to bear on this data set. Because it has over 15 different dimensions. This is more than anyone can even visualize, let alone find intricate patterns for each unique individual. But this is actually where AI can be truly transformative. And we've made a discovery. We found a pattern in the data. We found that when you look at all of those factors that are so important, we found that the results actually cluster and they group together into just 5 buckets that can let us holistically understand the state of a patient every day as they're dealing with pain at home. And we can use insights like these to know holistically, any day, are they doing well and they're in the best state, or are they suffering and they need our help, and they're in the worst state. And we can use it to tailor therapies to each unique patient. Because what we're looking for is more than just understanding. We want to make sure that that patient's story can get heard by the already busy clinician, and that they can have the time to get to a deeper conversation with them about the right option for them at that moment in time. At Boston Scientific, we're making innovative pain therapies at every step along that patient journey, so that when patients get there, they have the right option and they have the right understanding so that their clinician can match them up. Because we want is for everyone to get relief. Erica's found relief. She's not just doing well out of pain, she's here on the streets of London dancing, and she's thriving, clearly. Unfortunately, my dad hasn't found that relief yet, and I want that for him. I want it for him and the millions of other people that are still struggling today. This is why transforming chronic pain care is about much more than just the devices. This is why we're building a holistic understanding of people living with chronic pain so that we know what state they're in every single day, and we can give them back what matters the most to them, their life. Thank you.